A seizure is defined as a transient occurrence of signs and/or symptoms due to abnormal, excessive, or synchronous neuronal activity in the brain. Although a complicated definition, simply put, this means there is excessive electrical activity, which clinically is seen as transient change in behavior or movement. In 2017, the International League Against Epilepsy updated the seizure classification guidelines, which used the onset of seizure as a first step in the operational classification of seizure type. This is why it is very important to gather information about how the seizure starts. According to the guidelines, seizures can be classified as focal, generalized, or unknown in onset. They can be further described based on what the seizure looks like. Focal onset seizures are those that start in one hemisphere of the brain. They can later spread to involve both hemispheres, but it is the beginning of the seizure and not the end that is the most important. Generalized seizures rapidly involve the whole brain. If the onset of seizure is missed or unclear, the seizure is of unknown onset. They can be further classified according to the patient's level of awareness, which can be preserved or impaired. To figure this out, you can ask whether the person seemed to know who they are and what is going on with the surroundings during the seizure. Awareness does not refer to awareness of the seizure occurring. Focal seizures can be further divided based on motor versus non-motor components. The final feature is whether the focal seizure evolves into bilateral tonic-clonic seizure.
Focal seizures have signs and symptoms that reflect the part of the brain which is involved. The final feature is whether the focal seizure evolves into bilateral tonic-clonic seizure. A seizure which is generalized in onset involves both the right and left hemisphere at once. Similarly to focal seizures, generalized seizures are classified according to motor or non-motor manifestations. The motor manifestations can vary and include tonic-clonic, clonic, tonic, or atonic. The non-motor generalized seizures mostly refer to absence seizures.